By definition, it's a malfunction of the immune system. It's when this system becomes haywire that we see identification of allergy starting. In other words, we take something that is not dangerous in the environment and you get exposed to it, like your pet dog or cat, and you become allergic to it. That's not something that poses a threat to you, but somehow the body says, hey, you know, this is a problem and we're going to respond to it. And they respond to it in an allergic way. As you know, the typical person will come in sneezing, congestion, nasal drainage, postnasal drip, itchy eyes, hoarse, scratchy voice, and seasonal variations. That's allergy. Let's talk about genes. Not the genes you buy at the Gap, but genes that are in our body. The genes determine our allergic response. If you have the genes for cat allergy, but you live on a desert island and you've never seen a cat in your whole life, you're never going to have the allergy symptoms of cat. So you have to have environment. So you have to have two things. You have to have the genetic makeup for allergy, and you have to have exposure to the allergen. An allergen comes around and gets into the tissues, you will have a release of all these chemical compounds, such as histamine. You've heard of histamine, because antihistamines. A lot of people take antihistamines because that's the first compound that's released and the compound that's most abundant. And then they travel to the various tissues of the body that are involved in allergy. And that's basically how allergy works.
The first thing that happens when a patient comes into our office and wants to be evaluated for allergy is that we will take a very thorough history. The reason for this is that a large percentage of the time, diagnosis can be made on history alone, and so we'll be asking you a lot of questions when you come in. The second thing will be an examination, and we'll specifically be looking at your eyes, ears, nose, and throat. The third thing that will happen is testing. The reason for this is that this allows us to confirm our diagnosis, and so further testing is usually needed. So there's two methods, either a skin or a blood test, and we do this in order to find out what substance or allergen may be triggering your allergic response. Skin tests are usually done because they're rapid, reliable, and generally less expensive than a blood test, but either type of test may be used. First thing we need to do when we think of treatment is control our exposure to the thing that we are allergic to. Sometimes we can do this, sometimes we cannot. So the things that we can control are in our environment, the things that are around us in our homes. One of the things we can control are dust mite exposure. Now, dust mites, we know, are too small to be seen with a microscope, but they thrive in warm, humid environments. And so the places we can find dust mites mostly are our homes, bedding, upholstered furniture, and carpeting. After we try to avoid our trigger and control those things in our environment that we can, most people then go on to medication. The most common medications for allergy treatment include antihistamines, oral or eye drops, decongestants, nasal steroids or nasal antihistamines, leukotriene inhibitors, oral steroids, which are usually reserved for very severe reactions. When all else has failed, including the environmental controls and our medical therapy, then it's time to decide if you would like to undergo immunotherapy. Well, there's two pathways. The first one is injections under the skin, which is called subcutaneously, or by drops under your tongue, which is known as sublingually. Each shot contains a tiny amount of the allergens you are reacting to. They contain just enough, though, to stimulate your immune system and not to cause a full-blown allergic reaction. Over time, the dosages of the allergens are increased, which then helps your body get used to the allergen that you're reacting to. And this process is called desensitization.
And here's one. You have mentioned vasomotor rhinitis. What is it? Well, it looks like allergy, but it's not really allergy. It's a nerve response, very similar to the allergy because there's nerves in the nose, and when they start giving off their responses with their chemical mediators, they produce the same response in the nose with the same chemical mediators. But by testing with allergens, you can skin testing or blood testing for allergens, if they're all negative, then you know you have probable vasomotor rhinitis or hyperplastic rhinitis. Usually this gives you a very, will give you a problem when you're exposed to toxic fumes. For instance, near cigarette smoke or perfume or temperature humidity changes would cause vasomotor rhinitis because it stimulates the nose.